You are listening to Seniors Junction podcast. We're preventing seniors isolation one conversation at a time. Your hosts today, Dr. Namrata Bagaria and myself, Dr. Paul Merkley, co-founders of Seniors Junction, and our very special guest today is Dr. Julianne Holt-Lundstadt. She is a professor of social psychology at Brigham Young and has done a great deal of research on connectedness and conversely on isolation, and has some of the stats that are so important as hard evidence for what we do. Welcome.
Thank you. I'm happy to be here.
So could you tell us a little bit about yourself and what you do?
Wow. Where do I begin? So my research has focused on social relationships and our social connections and how that impacts our physical health. And I've actually been studying this for about 2 decades now. And this work has spanned from looking at the overall effects and association between different major health outcomes and risk for premature mortality. But it's also looked at some of the biological pathways by which some of these health effects can occur, as well as looking at factors such as relationship quality and how that matters. And so I've really tried to take a interdisciplinary approach to understanding this because it is such a complex issue and there's still so much to understand.
That's fascinating, and you can't imagine how pertinent it is for us. How long are some of the longitudinal studies that you've been looking at?
Yeah, so in my meta-analyses, they on average, so that means averaging across some that are shorter and some that are much longer, it was about 7.5 years. And so some may have only followed individuals for maybe a year or two, whereas others are following individuals for decades. And so on average, it was 7.5 years.
Thank you.
And Professor, in your line of work, you must have encountered social isolation as a pain point. And so what is your opinion or your perspective on what is social isolation and what are the key pressing points?
Yeah. So as we, when I say we, I'm really talking about the entire field as this evidence emerges. There's good evidence of the protective effects of being socially connected, but conversely also, as you mentioned, those social deficits, and social isolation is one of those. And so I'm always careful to try and define social isolation as separate from another related term, loneliness, that often gets used interchangeably, and while they're related, they actually are distinct concepts. And so social isolation is really the objective lack of social connection. Having few or infrequent social contact, few social roles, and perhaps membership in social groups. On the other hand, loneliness is really more of a subjective concept. It's this distressing subjective feeling, instead of isolation objectively being alone, loneliness is perhaps feeling alone. It's defined as the discrepancy between one's actual and desired level of connection. And so it's important to recognize that while certainly being objectively alone puts you at increased risk for feeling alone, that you can certainly be isolated but not lonely. You might actually enjoy your time alone and that solitude. And conversely, you may not be isolated but still feel lonely. So you might be surrounded by other people. and yet still feel profoundly lonely. And so these are both important for our health and well-being, but they're slightly different, and the way in which we might address them might be slightly different also.
This is, I think, the best explanation I've heard. This is, I think, episode 31. And so all these days we've been podcasting, we've been reading, learning, but this was by far the best explanation of objective versus subjective feeling alone, and of course how it influences. And so I just wanted to go a little deeper. So what were your main findings of your research so far, or if you have to like just say a bullet, like a few bullets of what are the precipitating factors, or what jumps out, some kind of correlation?
So, from my own work, I did a meta-analysis on social isolation, loneliness, and living alone, and risk for premature mortality. And that meta-analysis included data from 70 longitudinal studies. It included over 3.4 million participants. And this was based on all of the available data worldwide. And what we found was that they all significantly predicted risk. So loneliness increased risk for earlier death by 26%, isolation by 29%, and living alone by 32%. And despite these relative differences, they actually weren't statistically different from each other. So what that suggests is that they all equivalently predict risk for premature mortality. And that's, I think, something that's noteworthy, because we sometimes think that perhaps one might be more important than the other, but that suggests that that each of them may contribute to risk. Now, importantly, there have been additional studies that have been done since that time, and these have replicated these findings. And so we have pretty strong confidence that these influence our risk for premature mortality. There's also evidence across multiple health outcomes. And some of the strongest evidence comes from cardiovascular outcomes. So increased risk for cardiovascular disease and stroke. There is some evidence in terms of other health outcomes, including things like diabetes. There's also evidence of increased risk for poor mental health as well as cognitive health. So increased risk for depression, for example, when it comes to mental health. And for cognitive health, increased risk for mild cognitive impairment, dementia, and Alzheimer's disease. And so it's really quite remarkable that there's evidence across these three key contributors to health, our physical health, our mental health, and our cognitive health. And so really what this suggests is that this influences not only our health, but also, and I should mention, some of the strongest evidence comes from risk for premature mortality, and that's mortality from all causes.
It's very striking. Thank you very much. Sounds accord with me, I'll tell you that. And I couldn't help but focus also on one thing you mentioned about the quality of relationships. Are there metrics for that too?
Yeah, so that's a really great question, because the way the field has evolved, initially a lot of the really early research focused on more of the structural or objective kinds of measures of relationships. So what I mean by that is it would often look at things like the size of one social network, or whether or not someone is married or living alone. And so these are quite objective and are somewhat easy to measure. But then as the field kind of progressed, there became more emphasis on the functions of relationships, the extent to which you can actually rely on these people for support, for example. And so there was, so there's a great deal of research on some of these functional aspects and really focused on social support. There are fewer studies that have looked at the quality of relationships. And so if you think about it conceptually, we need to have others in our lives, but the functions that they serve also are important. But it's also important to measure the quality of those relationships, because as we know, not all relationships are entirely positive. Relationships can be sources of strain, conflict, frustration. And so relationships may actually be sources of interpersonal stress. We also know that relationships vary in the extent to which how deep the relationship or how intimate the relationship is. And so there is evidence to suggest that quality does matter, and that actually negativity in relationships has been associated with risk. And so it's not just having people in your lives, but having positive relationships that seems to be associated with some of these protective effects. And so really it's part of a holistic picture of relationships to incorporate that component of quality along with those other measures of relationships.
Thank you. One theme that has come up in previous podcasts has been intergenerational friendships. Is there anything that's known about that, or something you could surmise?
Yeah, so this is a growing area of research, and unfortunately, it's not something that I have been personally involved with, but what this suggests is certainly some promising findings. And what I am so energized by is that we know that both isolation and loneliness can affect anyone at any age. And in fact, there's actually some evidence to suggest some of the highest prevalence rates are among younger individuals. And so these intergenerational approaches have the potential to really benefit multiple generations. And so it's not necessarily one generation helping the other generation, because they're both helping each other.
Thank you.
So what's your vision to solve this problem, or maybe a few pointers around how can we tackle this issue?
Well, I'll just first say that it's complicated and complex, and certainly no one person or no one sector can do it alone. And so my vision is to really see, and this I think also is echoed substantially in the National Academy of Science consensus report that I had the honor of being a part of. And one of the things that we recognize and write about is how every sector can potentially play a role in addressing this issue. And while that report was focused on the medical sector, certainly other sectors can play a role. And just to get everyone thinking about this, I want you to just think about the last year and a half of the pandemic, and how, because of efforts to reduce social contact, to reduce the spread of the virus, it has affected every single aspect of our lives. I mean, from the education, the health sector, the even entertainment, transportation. There's almost no sector that hasn't been impacted by this. And what that suggests is that if we can see how these sectors have been impacted by that, we can also see how each of these sectors could potentially be part of the solution. So if these sectors can reduce social contact, they could also potentially be sources of promoting and fostering and enhancing social connection. And really, when we have that more cross-sector approach, we can better fill in some of those gaps and really reach people at every point in their life to help them stay connected.
Given what you just said, what do you see as some of the challenges and what are some of the opportunities?
Oh, there's so many challenges. One of the things that is a big challenge is just, and I'd say a challenge and a huge opportunity, and that is practice and policy. And so oftentimes we are unable to do something because that's outside the norm, or it actually contradicts some kind of policy or procedure. And I think the pandemic actually gives us this opportunity to reevaluate some of these practices and policies. And I think we've already seen where, when forced to, that the way of business as usual, when it has to change, it can change. And similarly, we can be much more intentional about it. And so that we can be thinking about the kinds of practices and policies we want in place, and that when those are barriers, how do we change those? And so I'm not saying that it's something easy. In fact, that's part of your question was, what are those barriers? I think they can be incredible barriers, but I see this as an opportunity where people are reevaluating these practices and policies. And so this is a huge opportunity for us to be intentional about this.
Instead of just reacting to a virus, we could actually take some thought and deliberation and design some of these practices with a view to fostering connectedness and purpose.
And what's great about, well, I shouldn't say great about this time, but perhaps the silver lining of this, past year and a half is that there has been a flurry of research, and people are collecting data and seeing how things have been affected. And we can use that data to inform these kinds of decisions. And as you say, instead of being reactive, be quite intentional, and we can use this data to inform that.
Thank you.
Yeah, I concur with a lot of what you say. I think intentionality and design by purpose is something that I think is very important. Business as usual, long-term care homes across North America, Canada, US, they've had staffing issues. They've had issues since a long time. And now when you redirect your resources from, say, activities and recreation to safety, like COVID checks and stuff, and you think of doing that as, okay, we can do one thing later. And then you see the mental health of the residents, or even people who are aging in place, and suddenly they can't do the things they were doing to stay connected. And then the digital divide, or even the norm, like I'm one of those people who can comfortably establish a new friendship or relationship online, like with someone, because that's what we've been doing through our business. And I've been working telemedicine all for like a decade or more than that. But I've seen many people who struggle, and they're waiting for things to open up so they can finally start meeting people. So I see the difference in the two approaches, and definitely I do miss the old way of meeting people, but you've got to adapt with what's there, because we never know. And I see that the change management piece that you've been alluding to indirectly, I think a lot of it is change management and attitude shift, which is the harder part of doing something than the evidence part, because you might have all the evidence in your face and it's been there for decades, but it's like, who's gonna do it? And even if you do it at a leadership level, how do you then percolate it throughout the organization? So my understanding of any kind of digital transformation or any kind of transformation project has been change management. Like if that is something that is a make or a break in any kind of project. Anyways, so what is your advice for a startup like us, which is focusing on social connectedness for older adults?
Well, I mean, the first thing I need to say is just I am thrilled that you're doing this. It's so needed and so important, and so many people can potentially benefit from what you're doing. So the one, I guess, advice I would have for you and anyone else who may be designing programs for older adults is to really also think about evaluating what you're doing. And so I'm often asked, what kinds of things work to help people feel more connected. And the hard part is we know we have lots and lots of evidence that shows that when people are socially connected, it's very protective. But where we have less evidence is when people aren't, what efforts are successful in creating those connections or helping people feel more connected. And so that's a little bit trickier. And simply because we perhaps design a social group or an activity or some kind of service or device doesn't necessarily mean it will be effective for all in all cases. And so it's always important to really test what you're doing if it's having the effect, the intended effect. And to because of course you probably also want to know ways it could potentially be strengthened, even if it is working great, and if there's anyone you're missing, because there are some kinds of approaches that are maybe more desirable for some individuals, or there may be barriers that you may not be aware of. And so if by testing this, you can begin to understand if there's anyone that you're trying to reach that might be missed. And so those would be some of my kind of broad level pieces of advice.
Thank you. I think what you're saying is true. We've realized that different people connect differently, and that's why we need, though it's social connectedness, but you need to somewhere personalize that approach.
Yeah, so can I add just an example to that? I think of social activity kind of like physical activity. And
yeah,
not everyone likes to run or swim. Maybe they like to walk, or they may have preferences. And so some activities might be more appealing to some individuals than others. And so just like we, have to think about the kinds of preferences and barriers that exist when we try to get people to be more physically active, we need to think about some of these things when trying to help people become more socially active. And then true, and it's true for ourselves too, of course.
No, I think that's well suggested. Like we've noticed, like some people will do well. Like there's some kinds of individuals who come for the workshops or the courses we do. They like to do their homework, read, and then ask with questions, right? So one part of our intervention is you always get a book, whether a textbook or a workbook or a book, like a regular book to read, and then it's divided over 8 weeks. So you have to, because we also want them to develop their solitude along with their connectedness, because both have to go kind of parallel. So we've seen some people, they come with the excitement for knowledge. And there's some who will do extremely well when we give them breakout rooms to talk to each other. But then some will not do very well with one-on-one, but they'll do well with the group setting. And so you see within a bunch of people, it's so nuanced. We're learning. We don't have the hack yet. If we do, of course, we will be very happy to know what's the solution. And also, we haven't factored in yet the personality types, introversion, extroversion, definitely having a variety of activities. And what limits us majorly, even like we're doing everything virtually right now, right? So whatever can be done virtually. So fundamentally, people who don't like to socialize virtually are automatically out of what we do. And there is a sizable amount of people, even youngsters, who even if they have jobs where they need to online connect, wouldn't do it for social connection, right? So what I've started realizing is the ones who are actually coming have a decent amount of connectedness. And all we are doing is increasing it a notch further, adding purpose to it. But the ones who are disconnected or completely like not bought on the digital journey, of course, we've not factored that in. And that would be something I think we will have to think as things open up, because right now there is no way we can even do those focus groups or meet people. Like as the restrictions open up, yes, we can. I mean, they are opening up, but they might just close again. So we're not doing much. We are also on the fence. Like, okay, should we not? Those kind of things. Yeah, so that's wonderful advice. Thank you.
Well, and I'll just mention, I did a study with some colleagues at UCSF during the pandemic. And one thing that we found was that, and I'll just give the caveat that these were older adults in the San Francisco Bay Area who were very at high risk. And what we found was that the majority of them did not use any kind of video chat or other kind of tech, or I should say higher tech kinds of devices or tools to interact socially. But what they did use was the telephone. And so sometimes when we can't reach them through perhaps some kind of video chat, we can always pick up the phone. And so that may be an option for some older adults that may be missed through some of these other tools.
Yeah, I think we see that by just older adults. We see it within our company. We have people who work, like our interns, age 19. And we in a day, we can even deal with people who are with 95. So 19 to 95, 99, right? So it's a very broad age range. We talk with people, work with people. Most of our interns don't do video calls. They're like, they find it old fashioned. They're like, who does that? So if you come on any call, it's audio. They will be like logged in, but audio. So like Clubhouse is one of those examples why it's so because it's like, and then the other day they were like, who uses Facebooks? Because I was like, why are you not able? And he goes like, it's such an ancient tool. And I looked at them and I'm like, don't ancient me. What do you think? Like, I felt so embarrassed.
What's that say about me? What's that say about me?
Yeah, and then we have a Facebook.
No, I get it. Yeah. I mean, I was even trying to, I was talking to some colleagues and we were talking about trying to do even research studies. And on the one hand, we were mailing out surveys to some people that we didn't think were going to be online. And then in other groups, it's like, who gets anything other than junk in the mail? No one's going to pay attention to a survey that's in the mail. And so, regardless of what method you use, you may potentially be missing a portion of who you are hoping to contact. And so, it's all the more reason to really be thoughtful about who you're trying to reach and how you can best reach those groups.
Yeah, we did like a fun exercise within our WhatsApp group about how, remember, Paul, we did that little game,
that was
who
really
likes
fun.
in which way. Yeah, and we made like this greater than this, greater than that, like, oh, this equal to like from like, and so that we understand each other, because it's sometimes what would happen, one person would communicate more, say texting, and for the other person it's like, I don't know what you're talking about. So it was like, it was just fascinating, that little experiment we did within ourselves. But we also see that across, like if you go on the Facebook group that we have for the startup, it's individuals who are older adults, seniors. I am totally irrelevant in that group. Anything I post never gets a like or a comment. But if we invite them for anything live, like let's do a Zoom or an audio or whatever, nobody comes. So they're very happy just sharing stuff on that group. That's their connectedness, for I don't know, for whatever reason. So it's so fascinating to see that even with the little sample size, are the ones who come for a classroom don't like to use social media. The ones who are on our social media don't like to come to our classroom. So it's like, how the hell do you market? And I am like, because that's what my job in the company is, and I'm like, okay, I have never encountered this issue. The users are not the ones who are available online, and the ones online are not interested in buying. So how the hell do you sell? And of course, if I solve that, then I'll be having another conversation of how to scale a senior startup and some other lecture somewhere. But I think well-received suggestions. And we are also quite open to paper pen. By the way, if you live in Canada, the hospitals still work with mail. You get your appointments via mail, and even your reports. So, and fax machines still work here. So I don't know if that's the case in the US, but in Canada, it still works. Anyways, so if people want to find you, what's the best way to find you?
Well, they can find my website, which actually needs to be updated, but they can find me on Twitter and on Instagram. If anyone's interested, I also have a recent TED Talk that they can watch online as well.
Perfect. And I shall be putting the link for the TED Talk in the podcast video, along with your Twitter and other handles. So
okay.
Thank you so much, Professor.
Thank you so much.
Thank you very much.